Thanatophoric dysplasia seen in a 30-year-old gravidasis para 5 who was not sure of her date because she was lactating. Her last childbirth was 2 years prior to presentation, and she presented with mild respiratory compromise. The simplicity of fundal height was 38 centimeters, but dating scan at presentation using the abdominal circumference puts her date at 28 weeks, 4 days. When the circumference was measured, dated the pregnancy to 39 weeks. There was associated polyhydramnios, tetramicromelia, macrocephaly with frontal bossing, depressed as a bridge, triventriculomegaly, and temporal lobe dysplasia. Where the findings were narrow thorax, excessive soft tissue around the limbs, increased knuckle fold thickness, and broad and short fingers and toes. These are features in keeping with thanatophoric dysplasia. So the couple were counseled and they opted for termination of pregnancy. And the product was a fresh stillborn female who weighed 1.6 kilograms. So thanatophoric dysplasia is the commonest lethal skeletal dysplasia due to mutations involving fibroblast growth factor 3. It could be sporadic or as a de novo autosomal dominant. There are two types. Type 1, which is the majority, is characterized by the French telephone head appearance of the bone, short curved and broad bones, while the type 2, which makes up 20%, is associated with clover leaf skull and the bones are straight, unlike what you have in type 1. So let's see what type we have in this case. My teacher told me that the brain finding of temporal lobe dysplasia is classical of thanatophoric dysplasia. We shall see this French telephone hen bone towards the end of this video. So so these are the eyes and not the dilated anterior horns, third ventricle, lateral ventricle. So triventriculomegaly. Not the normal nose-chin view. The mouth here appears to be smaller than expected, subjectively though. So not about normal nose-chin view. The features will now show us the right hand. You see that? So not the short right upper limb. The left is here. No datability of the amniotic fluid. Shortly we shall see the narrow thorax. Not the lower limb. Look at the femur, short and bowed. Look at the narrow thorax. The four-chamber view is apparently normal, as one can see here. Okay, and now that the stomach here. Again, the external genitalia, the short femur, not the broad femur. Look at the normal insertion of the umbilical cord, obvious polyhydramnios. And here, so look at the telephone receiver head here, look at it. The French telephone receiver head. So not the excess subcutaneous tissue here, so soft tissue, not the excess soft tissue in the lower limbs. French telephone receiver. So here, look at this skull. Look at the appearance. Look at the sutures are not fused, so there is no craniosynostosis. Or look at the occiput here. It's straight. While the frontal bones are pointed. So this is what is described as the strawberry skull. The first description of strawberry skull was by Nicolaides in 1992, where 80% of cases that had strawberry skull had trisomy 18. For this paper, published in the White Journal in 1994, first described strawberry shaped skull in fetal thanatophoric dysplasia. This case is a case of suspected thanatophoric dysplasia, and this description fits strawberry skull. So in this case also, it's a case of thanatophoric dysplasia with strawberry skull. So not the triventriculomegaly. Probably there is some obstruction at the aqueduct of Sylvius, since the fourth ventricle appeared normal. So look at these still images. So look at the posterior fossa in this case. So it is dysplastic posterior fossa. These are the cerebral peduncles, and this is the vermis. So this is dysplastic. As you can see here, this is the straight occipital bone, or flattening of the occipital bone and pointing of the frontal bones, a feature of strawberry skull. Look at the short and bowed bones, a feature of type 1 thanatophoric dysplasia. Here, not the excess soft tissue. Look at the bowing here. In fact, initially I thought this was actually a fracture, but a fracture is more of a feature of osteogenesis imperfecta than thanatophoric dysplasia. Here you can see the bell-shaped chests and the abdomen, and look at the ratio. So the chest is narrow. Again, look at the neck, short neck, narrow chest, protuberant abdomen. And look at this skin fold thickness here. It's quite thick. This would have been picked in the first trimester as increased nuchal translucency. So in this case, here look at this short upper limb, not the broad bones. And look at the umbilical cord here, showing us the typical big mouse appearance, telling us that there is no problem with the umbilical cord. So here you can see the short right upper limb with broad hand, and here you can see that there is no polydactyly. 1, 2, 3, 4, 5. The hands are supposed to cross the midline, but here they are not because they are short. Look at this frontal portion, depressed nasal bridge, and look at this nasal, I beg your pardon, nuchal fold thickness, short neck, belly shape, chests. On 3D, look at the frontal portion on 3D, frontal portion on 2D, depressed nasal bridge on 3D, depressed nasal bridge on 2D, and look at the live specimen here. Frontal portion, frontal portion, frontal portion, depressed nasal bridge, depressed nasal bridge, depressed nasal bridge. And look at the hypertelorism here. The interorbital distance is wide. Look at where the arm stopped here. Short arm here, and protoberal abdomen. Narrow chest, narrow chest, narrow chest. Protoberal abdomen, protoberal abdomen, protoberal abdomen. Look at normal relationship of the leg and foot. Normal relationship of the leg and foot. Low set ear, low set ear. Increase knuckle fall, increase knuckle fall. So this is comparing a normal posterior fossa at 25 weeks, at 22 weeks, with in this case. So look at normal cerebellum here, vermis, normal cerebellum, vermis. Look at this plastic posterior fossa. This is at 25 weeks. Look at the normal thigh here, the leg. Look at the soft tissue. Compare with this. Look at the excess soft tissue here. Compared with this. Look at the excess soft tissue here. Compared with this. Normal chest abdominal ratio seen in this case. Well, look at this bell shape and protuberance. So this is not normal relationship. Not the knuckle fall thickness. So what case are we dealing with here? Thanatophoric dysplasia type 1. Well, thank you very much.